Namaskar. Hello, everybody. I'm back. Dr. K.K. Aggarwal, President Heart Care Foundation of India and Confederation of Medical Association of Asia and Oceania. You are watching Med Talks with Dr. K.K. Aggarwal, a daily show at 7 p.m. on various social media. And we are dealing with COVID edition. And today we are going to have a special episode on high blood pressure. Before I announce further, let's have the headlines of the day. Delhi is going to have another milestone. By Friday, we will have a second phase of zero survey. In the first zero survey, 24% of the population was shown to have antibodies. Therefore, a Delhi model of home isolation and conservative management can give us a hope towards early herd immunity. 2,000 people tested by Israeli kit. They use different techniques, and if successful in future, you may have smart kits diagnosing COVID-19 within 30 minutes. Human trials of second COVID vaccine candidates move to phase 2. In India, all the three companies, whether it is a Serum Institute, whether it is Pfizer, or whether it is a ICMR-led vaccine, all three of them are going now in phase 2. Let's see what Prime Minister announces on 15th of August. 96% of 60,000 ventilators being procured in India are indigenous. A time will come, we will be no more dependent on China, and we will have indigenous production of all medical equipment. Yes, breastfeeding week, 1st of August to 7th of August is breastfeeding week, and breastfeeding is not linked to COVID-19. That means women who are COVID positive should continue giving breastfeed to their newborns. That's a message for the breastfeeding week. Let's now go to the topic of the day. High blood pressure in patients with COVID-19. There was a time when it was said that if you have high blood pressure means you're going to have high mortality. No more true. And now we know that if your blood pressure is controlled, A, you are not extra risk. B, your disease is not going to be severe. C, you're not going to end up into a high mortality. So good news for patients who have high blood pressure. And to talk more about it, let me introduce my guest of the day. I have with me Dr. A. Muruganathan. He is Emeritus Professor, the Tamil Nadu Dr. MGR Medical University. He is the Governor of American College of Physicians India Chapter. He is the Chairman Shrishti AG Hospital, Tirupur in Tamil Nadu. He has served as a Dean of Indian College of Physicians from 2016 to 17, past President of Hypertension Society of India, Association of Physicians of India, and the IMA Tamil Nadu State Branch. He is a BC Roy National Awardee. Welcome to our show, Dr. Muruganathan. So let me come back that COVID-19 is not going to go. We know today that hypertension is no more a risk factor as it was thought earlier. It is now shifted from a risk factor to a possible risk factor. And if you control hypertension, you're not at extra risk. But I have heard, Dr. Muruganathan, you have framed a term called lockdown hypertension, that your observation has been during lockdown, people have uncontrolled hypertension instead of normalized or lower hypertension. Can you explain?
Yes, thank you, Dr. Aggarwal. At the outset, I must congratulate you for the wonderful work you're doing every day, and the public is aware. Especially in this WhatsApp university, where WhatsApp gives lot of false messages, and your message with scientific knowledge, I think many people will release it, and it's good for the country. Coming to the hypertension, you see, in India, there are more than 20 crores of people with hypertension. Another 20 crores of people are in the stage of developing hypertension. So it's a huge problem. It's a huge problem both for the health point of view or also economic point of view. In the COVID times, especially lockdown, what happens was everybody was worried about COVID, and they take some medicines and they buy medicines for only 15 days. And when the medicines are over, they don't want to go out and buy medicines because of the fear of COVID. Number one. Number two, they don't think there is any problem with hypertension because they are at home, sitting at home, relaxing, so no problem. But actually, seeing all the persons who are at home, they make their home as office and office as home. So they have lot of worries about their future, anxiety, tension, and depression. And there are so many other issues. When they are at home, they get a very good food. They don't care about other things. They eat, watch television, sleep, and they don't have place for exercise. They used to go for walking. Now, because of the lockdown, they don't go for walking also. And many of them, as I said, they are not aware about the importance of controlling hypertension. And nobody checks the blood pressure because they are not able to go to the doctor. So because of all these things, in my observation, when I did some survey for 100 people, lockdown has really produced more hypertension. The people who were controlled with one tablet, when they came to us for the checkup, the pressure was more. So meaning that that one tablet was not enough. It was actually more, and they have heart rate also more because of their anxiety and tension. So this is why I call this as lockdown hypertension, and I definitely convey one message: all of the patients who have blood pressure should buy a home blood pressure monitoring and check their blood pressure periodically and convey to the family physician in the teleconsultation or by WhatsApp, so that the doctors will advise you and you also know what your blood pressure is. So you can take in the morning and night also, so that if there's any fluctuation also you can find out. So home blood pressure monitoring is handy in this lockdown hypertension. And I request all the people who are watching, buy medicines for 30 days. Don't buy for 10 days because you will have lethargy and compulsion. 3 days, 4 days, you may not go. Now that Saturday, Sunday is totally locked down, you may not go. So that is why people buy a lot of things, eatables, snacks. They bring it. And Saturday, Sunday, because they cannot go out, they enjoy the food at home with family, which contains salt. So there is no diet restriction also in this. Yes.
So
please,
normally during lockdown, we were expecting that there will be better sugar control, there will be better control of hypertension, but we have seen the reverse. So there is chances of developing a lockdown diabetes and a lockdown hypertension.
Correct.
Number two is that in India, we have seen that our younger generation has comparatively more heart rate than in other parts of the country, another part of the universe. Probably we live more in a stress, a chronic stress, and we have more hyper sympathetic state of mind, and we have increased tachycardia, and that also may be responsible for high blood pressure in the country. Do you feel that in India, if we go for a yogic lifestyle, meditation, relaxation, or a small dose of beta blocker, shorter acting, will work, specifically at the time when you have a fear of COVID death?
Correct. See, actually, the India Heart Study also observed lot of Indians, especially youngsters, they have not only high blood pressure, they have high heart rate also. Meaning there is overactivity of sympathetic overactivity, and then most of them have always, in the frame of mind, hurry, burry, heart, curry, and worry. So because the youngsters, they are more interested to make money. They are, they are not worried about their health, and they don't know yogic practice. See, all over the world, people are learning yogic practice from our country, but they don't know, and they don't know what is meditation. They cannot sit idly for 5 minutes. They either do a computer, they WhatsApp, they'll be in social media, they do all sorts of things. They cannot concentrate or focus on one particular thing. You are rightly said, there's another study which says even young people, they have systolic hypertension. See, in our days, we used to think systolic hypertension is for more of elderly. But we also see nowadays young people developing systolic hypertension. Another point also, they develop hypertension, patients develop diabetes 2.5 times more than a normal person. A hypertensive patient has got risk of 2.5 more times for developing diabetes. Same way, a diabetic patient, 2 times more chances of developing hypertension. So what normally I tell the patients, when you are hypertension, you please look for diabetes. When you are diabetes, look for hypertension. So thereby you can control, as you rightly said, when you have control diabetes, control hypertension, you will have a normal life, nothing to worry.
So hypertension and diabetes goes hand in hand. Always look, if you have one, look for the other. Now, up till now, what we have seen is that diabetes needs to be controlled, lifestyle management or drugs, but you need to keep it under control. Aim a diastolic blood pressure of less than 80 if possible. Now, coming back to the COVID, that means during COVID, then I'll come back to the post-COVID phase. During COVID means 9 days of illness. Till on 9th day, we know the virus is non-replicable. The virus is not going to infect others. So therefore, in the first 9 days, two things are there. Some people, 30% of the people have loss of smell and loss of taste. They will have a loss of taste to the salt and the sweet the first. They will continue having taste for the anything which is sour. So therefore, during that period when they have a loss of taste for the salt, they end up in eating more and more salt without knowing it. And that can be the reason of continuing hypertension during the first few days of COVID-19. Your comments?
Yeah, I agree, because during the first 5 days, as you rightly said, some people have anosmia, some people have loss of appetite, loss of taste. So as you said, normally in Indians take more salt, and especially in COVID times, in the house, they don't separately cook for patients and their family. They'll all take along with the family the dining table, and they take salt. There are two things in the COVID hypertension. As you rightly said, for 5 to 7 days, asymptomatic people or mild symptoms or moderate symptoms, if they are very good, if they're aware about hypertension, normally the blood pressure is under control. One important point I would like to stress, if the blood pressure is under control, they are like a normal person. There is no increased morbidity or severity when you have COVID, even if you are hypertensive. A person who has not got control hypertension or control diabetes, they are more prone to develop morbidity and severity. So the first point of message is, whether you have a COVID or not, please control your hypertension, control your diabetes. Definitely you will be like normal. Even if you get COVID, it won't bother. So at least for first 7 days, if there is no problem, there's inflammatory markers may not go, the sympathetic overactivity may not be there. But if you go into the moderate or severe symptoms, then the problem comes. The hypertension can lead to so many cardiovascular complications, and you may have to land in the hospital, and you may have to be in ICU. So normally, if you are following certain principles of diet, if you're following the regular adherence of drugs, if you're following yogic practice and do exercise, diet restriction, salt restriction, eating more vegetables and fruits, because none of us eat more vegetables and fruits. The diet, DASH diet, internationally, and everybody says you must take 4 times vegetables and 4 servings of vegetables and fruits, but none of us take, and that also can reduce your pressure. And salt intake in India is more, especially in processed food like chips, pickles, appalams, all that contains invisible salt. So our salt intake naturally goes up, and when you go out, you will sweat. So when you sweat, you may need more salt. When you are at home, you don't have sweating also. So more and more salt can also increase. And if you're a diabetic, the salt sensitivity is more. So if you get more salt, definitely your point of loss of taste will increase the salt. That increases the blood pressure.
Absolutely correct. So two situations during COVID. A, mild inflammation causes oversympathetic activity. So therefore, your blood pressure will rise. B, if you have loss of taste, you check up every 2 hours. You take a salt and try to check up, has my taste come back or not? So you tend to overeat salt and sweet both, and that's what we say is that with the loss of taste, you may develop transient high blood sugar and high hypertension, specifically if you have a loss of taste. Coming back to now the post-COVID phase, during the COVID phase, the third thing is that we do not see cerebral hemorrhage as a complication. Therefore, it is unlikely that you are going to develop accelerated hypertension in COVID-19. Your take on that?
We have not seen many cases of what you call malignant hypertension or accelerated hypertension or hypertensive emergency. But in a patient who is not under control of blood pressure, in a patient who is obese, in a patient who is diabetic, when they land in ICU, they land with arrhythmias, more of arrhythmias. So they may have arrhythmia. So the cause for admission may be arrhythmia because of the hypertension. But we asked some of the neurologists. They say there is not many cases of hemorrhage, but there are people who are landing with thrombosis, cerebral thrombosis and hemiplegia. But as you rightly said, there is no accelerated hypertension in this COVID time. But when they land in hypertension in the ICU, the BP is fluctuating. Some people will have low BP because of the heart failure. They may develop cardiac complications. There also the BP goes up, goes down. So in a situation where there is a post-COVID, and especially when a hospital, you must try and make sure the blood pressure measured properly and put them on short acting. Instead of long acting, you change it to short acting. Suppose we has got beta blocker also, there are long acting beta blockers, short acting beta blockers. So it's preferable to have short acting beta blockers so that you can always control the pressure. And your point of accelerated hypertension bleeding, of course, I also don't see many cases, but my neurologist colleagues say they develop thrombosis also. So bleeding is not that much as thrombosis.
So in hypertension, large vessel thrombosis, specifically the middle cerebral artery, is well known because of a hypercoagulable state. So both diabetes and hypertension patients can be prone to get a cerebral thrombosis, including heart attack, because of a hypercoagulable state. Coming back to the post-COVID phase, and in the post-COVID phase, we have persistent inflammation in some people. We have raised ESR, CRP, interleukin-6, and a persistent inflammation can lead to a hyperinsulinemia state. They can cause a metabolic disorder, and hyperinsulinemia can have a persistent tachycardia and hypertension. Therefore, there is a role of short-acting beta blocker before, during, and after the COVID-19 infection. We will come back to the treatment part of it, and we will be discussing more about ACE inhibitors and AR blockers in COVID-19 management, but after a short break. You are watching Med Talks with Dr. K.K. Aggarwal, a daily 7 p.m. show on digital media. Through our digital media, we cross and reach 17 to 18 million people every month with a basic aim of removing the fear from the mind of the people about COVID-19. COVID-19 ke dar se azadi. And that's what we want to achieve, because COVID is going to stay. So before the break, our special guest, Dr. A. Muruganathan, he was talking about that before COVID, during COVID, and after COVID, whether it is stress, whether it is inflammation, whether it is pre-existing oversympathetic state, whether it is faulty lifestyle, not doing exercises, you may end up into mild to moderate hypertension. Fortunately, severe hypertension with severe hypertensive crisis, we are not seeing. But coming back to now, important thing is the controversy of ACE inhibitors and AR blockers. There was an initial controversy that because this virus enters the body through the ACE2 receptors, that if you give ACE inhibitor, it may increase the viral load but may reduce the cytokine crisis. Your take.
In fact, the first many thought logically, because the virus enters through ACE2, and when the ACE blocker or ARB is given, the ACE2 upregulation may cause more infection. But many studies have proved that our theory, our philosophy is not correct. In fact, animal studies shows the ARBs protect the lung. The ACE2 upregulation is also protecting the lung in the animal studies. And ACE2 is different from ACE. The people think ACE inhibitor means they think ACE2. They don't think ACE2. The ACE2 is different from ACE1, but ACE inhibitor. And then ACE2 also gives the angiotensin 2 into 1:7, which is good. So that point, many now, there a lot of confusion was there, but they are very clear now. If somebody is taking ACE inhibitor, ARB, they should not discontinue, because discontinue will make more problems. So the drive home message is, if somebody is taking ACE inhibitor or ARB during COVID, especially when they have COVID, they should not discontinue. This is done. This is recommended by all the international guidelines. No guideline says you should stop. Suppose if you are starting a drug, new patient, maybe you may not start with ACE inhibitor. You may start with short-acting beta blocker or a calcium channel blocker is good. But somebody is continuing ACE ARB for COVID, because of the COVID, they need not discontinue. There are so many pathologies, pathogenesis. I would like to talk because it's not necessary for you. Don't look into the WhatsApp. Don't look into the other unauthorized messages and then be panicked, because a lot of educated people, they say this COVID virus goes through ACE2 and this may block, and then there will be upregulation, so enhancement of the infection. It is not true. So they have to continue. That is the message.
So remember, because this program is both for doctors as well as for the public. For the public, it's easy to remember any drug which ends up with PRIL, P-R-I-L. So ramipril, enalapril, lisinopril, that's an ACE2 inhibitor. And any drug which ends up into a TAN, losartan, that's valsartan, TAN, and that's an AR blocker. These are a group of drugs used for hypertension. And if you are on ACE inhibitor or on any of the AR blocker, don't stop it. Obviously, your doctor will decide, if you are a new hypertension, which medicine to give you. That's one. As far as second thing comes back is the role of beta blockers. Let's revise again, Dr. Muruganathan.
Yeah, as you already said, this is a more of an inflammatory disease, and with the people with anxiety, the sympathetic overstimulation is there. So the ideal drug, that situation, is beta blocker. And when the patient is in the hospital, you will have to have a short-acting beta blocker. If the patient is at home, we can even start a long-acting beta blocker. Of course, we can monitor. So beta blocker is handy in this situation because of the increased heart rate, because of the sympathetic overactivity, because of anxiety, and the blood pressure control will be adequate and nice with heart rate control also with the beta blockers. So I would prefer a beta blocker, preferably a short-acting if they are in the hospital. If they are at the home, we can give long-acting also. So beta blocker, along with the other drugs, whatever they are taking. The key is they should check the pressure, as I mentioned earlier, home blood pressure monitoring, and inform the doctor in teleconsultation, and then adjust the dose according to their pressure. Because individualized, it is individualized. I cannot say you are a COVID patient with hypertension, take ACE inhibitor. COVID patient with hypertension, take beta blocker. No. According to the individual, we may change, and we can change the drugs, ACE, ARB, or calcium channel blocker, or beta blocker. But beta blocker has got definite role in this sympathetic and inflammatory conditions of COVID and hypertension.
Do not take beta blockers of your own. Talk to your doctor. Remember, this disease, post-COVID phase, can cause bronchitis, smaller airway obstruction. And if you have a hyperactive bronchial airway, your beta blocker may precipitate. So don't go and take it as a self-prescription. Beta blockers are to be prescribed by the medical doctors. Number 3, what's the role of Aldactone? Is there any specific role of Aldactone in COVID-19 patients?
Especially if the patient has got a tendency of fluid overloading and the kidney problem, maybe aldactone may be there, especially, sorry. When you need, especially when you need a small dose of diuretic, you can do. But one point of importance, when you add diuretic and if the patient has got hypertension and if they're taking SGLT inhibitor for diabetes, you must be very careful. You must adjust the dose of diuretic. So any diuretic when you use in hypertension, if the patient takes SGLT inhibitor and especially in ICU, as I said, because of the fluctuation, you must be careful in using the diuretics.
So you require proper hydration. So maintain your hydration and you readjust your dose with your doctor so that you maintain the hydration. That's very, 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 very important in this particular condition. Now coming back to a word about pregnancy hypertension, is there anything special in hypertension in children and COVID?
There is no special as far as I know about the pregnancy hypertension. Whatever drug they take, they can take. And pregnancy per se in hypertension, there is need not worry because there were a lot of webinars and seminars going on in the obstetricians when they have pregnancy and hypertension, and if they get COVID, any problem. If they control hypertension in pregnancy also, it's like normal hypertension. There is nothing, any anxiety about pregnancy. Only thing, ACE and ARB we cannot give in the pregnancy hypertension because naturally. So we'll have to definitely give the other drugs only. The beta blockers can, labetalol can be done, or as our old drug, whatever we are giving for hypertension, that can be continued.
So that was Dr. A. Muruganathan. We are talking about hypertension. And before I end, let me say my formula of 80. And that my formula of 80 is, if you want to live for up to 80 years without getting hypertensive failure, heart attack or paralysis, remember the formula of 80 कि दिल की धड़कन, नीचे का ब्लड प्रेशर, गंदे कोलेस्ट्रॉल की मात्रा, फास्टिंग शुगर और पेट की चौड़ाई 80 से कम रखो. Keep your lung functions and kidney functions above 80%. Walk 80 minutes a day, brisk walk 80 minutes a week. At least walk with a speed of 80 steps in a minute. साल में 80 दिन अनाज मत खाओ. एक बार में 80 ग्राम से ज्यादा कैलोरिक सॉलिड मत लो. एक बार में 80 ml से ज्यादा कैलोरिक मत लो, कैलोरिक लिक्विड मत लो. Do not take alcohol. If you take less than 80 ml and less than 80 grams in a week. Do दिन भर में 80 साइकिल पैरासिम्पैथेटिक ब्रीदिंग की करो, which is pranayam. Donate your blood at least 80 times in your lifetime. साल में कम से कम 80 दिन धूप में बैठो. That means 40% of your body should be exposed to sunlight for 40 minutes. If you do that, there are chances you will not get a heart attack till the age of 80. If you get it, don't worry about it. Ask your doctors for 80 milligram of aspirin and 80 milligram of statin. You may not end up into an intervention. If you need an intervention, don't worry. Ask your doctor, is my blockage less than 80% or more than 80%? If it is less than 80%, it's okay. If it is more than 80%, ask your doctor, do I need a surgery or an angioplasty? And if you do that, you will not die. Even if you die, so what? There will be somebody from the Hypertension Society of India or Cardiological Society of India or Heart Care Foundation of India who may have taught you the CPR 10 कि मरने के 10 मिनट के अंदर earlier the better, कम से कम 10 मिनट तक longer the better, 10 into 10 कम से कम 100 पर मिनट की स्पीड से अपनी छाती पीटने के बदले मरे हुए इंसान की छाती पीटो. You may be able to revive a person. That's what summarizes hypertension. One more thing, sleep is very important. Now we've proved beyond doubt, good sleep, your immunity goes up. And especially between 10 p.m. to 11 p.m., you have to sleep because the growth hormone, which is coming in between that time, 10 p.m. to 11 p.m., stimulates interleukin 12, which stimulates killer cells. So it is proved that good sleep is a good immunity. So have a good sleep. Don't,
have a sleepless night. Don't watch television till 1 o'clock in the night. Many people they do it. So sleep at early, and good sleep is good for hypertension as well as for your good health and for the immunity.
So before I end, let me take one question from the audience. Suresh Kumar Sinha, sir, I am 61-year-old. I was diagnosed with very severe BP due to congenital aortic problem, probably. I was operated in 1993 and aorta grafting was done. Since then, with regular medication, I was leading a near normal life. On 26th of July, I was tested corona positive. I had fever and throat problem and UTI. You never had UTI. This was COVID cystitis. I was given levofloxacin initially. Later, I was given azithromycin, doxycycline, Dexona for 5 days. What's your question? Your question is not clear, Suresh Kumar Sinha ji. You are only narrating what you got. That's okay. In COVID, remember, you can have COVID cystitis where you have a pus cells with a negative culture. This is the last question I'm taking of Kashif Raza. And he says, my father died on 29th July. He was COVID positive. Raza ji, we today in a COVID era, we say that my father was reborn on 29th of July. That's what the destiny is. I was in contact with him. After that, I have mild nasal blockage and throat infection. Obviously, you develop COVID. On 4th of July, 10:45 p.m., I had a breathing problem the whole night. Probably you developed a mild pneumonia. SpO2 decreased to 83, which is clear that you developed a bilateral pneumonia. And then I regained it to 96 after some time. I have mild sweating and little bit of weakness on 8th day. और मैंने COVID test नहीं करवाया. Doesn't matter because you have come in a contact with a person, positive person. Your symptoms are very classical and you have developed a mild pneumonia. I'm doing gargles regularly, drinking warm water regularly. I don't have wiener. Kindly suggest I am from. Yes, Kashif Saab, this is classical COVID-19 sickness. You are now recovering. The very fact you have already crossed 8th day. And what you should do is check your ESR and CRP every day for the next 3-4 days and check your exertional SpO2 level. Walk for 6 minutes and check for 6 parameters. 6 o'clock in the morning, 6 o'clock in the evening, walk for 6 minutes. Check for that. Can you walk 500 meters or not? Is your SpO2 falling by more than 5 or not? Are you developing exertional fever? Are you becoming short of breath? Are you developing cough? Or do you have difficulty in talking? If yes, contact your doctor. Otherwise, it's all okay. You're going to recover. Keep your father alive because these people, you will never forgive him because in the COVID time, every death is precious to the country because they have actually given their life for the benefit of the society, because we all were ignorant initially how to treat, but with the time, we are now in a process of reducing the mortality. That's all for today. Let me thank our special guest, Dr. A. Muruganathan, to be here and for his wonderful deliberations on hypertension. And I close the meeting with one message: keep your blood pressure under control, and COVID or no COVID, who cares? If I get COVID,
I always,
yes.
I give a message: follow woman, follow woman. Also tell your friends to follow woman. What do you mean by woman? Woman is W, wash your hands. O, observe physical distancing. M, mask yourself. A, adhere to good habits. N, namaste. Thank you.
That's a beautiful way of following a woman, and that by following a woman, you can also prevent COVID-19. That's all for today. We'll be back tomorrow, 7 p.m. to see another show of Med Talks with Dr. K.K. Aggarwal. Stay tuned.
Thank you. Thank you. Thank you very much. Thank you.